Hey, good afternoon. I think we're ready to get started. I want to thank everyone for coming to the press conference this afternoon to talk about a very important and serious topic that's affecting Buncombe County and affecting communities across the country. Today, Buncombe County has filed a lawsuit against the drug manufacturers and wholesale distributors that are responsible for fueling the opioid epidemic in our country and in our county. We are filing suit against the drug companies because they have pushed highly addictive, dangerous opioids, falsely representing to doctors that patients would only rarely succumb to drug addiction. We are filing suit against the wholesale drug distributors because they have refused and failed to fulfill their specific legal obligations to monitor, identify, report, and halt suspicious shipments of opioids. The prosecution of these types of cases may involve the investment of millions of dollars of resources for expert analysis and scientific and medical data that the county does not have. We have engaged outside counsel, and they have agreed to pay all of the costs associated with this litigation. Buncombe County will be obligated to pay no taxpayer dollars under this arrangement. Should the litigation be successful, the attorneys will be entitled to reimbursement of reasonable expenses and an agreed upon attorney's fee, all of which would have to be approved by the courts. The three wholesale distributors with combined annual revenues of $400 billion and profits in the billions of dollars failed in their duties and profited from the flood of pills into our community. The companies control 85% of the market for prescription opioids and profited from the opioid epidemic. In the last few years, the big three wholesale distributors have paid over $200 million in fines for the same conduct covered in the complaint. In the meantime, the state of North Carolina and Buncombe County are struggling with the toll opioid abuse is taking on our communities and public resources. According to the North Carolina Department of Health and Human Services, opioid-related deaths in North Carolina have increased 73% between 2005 and 2015. According to the Centers for Disease Control and Prevention, over 8 opioid prescriptions were dispensed for every 10 residents of Buncombe County last year. Nationwide, opioid abuse is now the leading cause of death for Americans 50 years of age and younger. In addition to the cost in human life, researchers estimate the total economic burden of the prescription opioid epidemic at $78.5 billion. I would now like to ask Mike Fuller, who is representing Barron and Budd, to come forward. His firm will be representing Buncombe County in this important case, and I'd like to thank him for being with us today and representing Buncombe County, and to share a few words about the action that we are taking today.
As the chairman mentioned, my name is Mike Fuller, and I got to say it's an honor and a privilege to be here representing Buncombe County in this endeavor. For the past 2 decades, communities have been ravaged by this industry, this opioid addiction. In the same amount of time, the death toll has increased 10 times in Buncombe County alone. There's been over a 511% increase in the number of drug-addicted babies born in North Carolina. And we believe, along with the county and the brave steps that these commissioners are taking, to step out and hold this industry accountable for what they've done, for the devastation that the county has to see on a daily, weekly, monthly basis, with deaths, with addictions, with foster care, through social services. We want to also recognize the commissioners for being some of the first in the state to take a stand on this issue, to file a complaint against those who are responsible for dumping pills into our communities. To make no beef about it, this case is about the number of pills that have been distributed and dumped into Buncombe County, as well as the rest of North Carolina. And the problem is, and what we hope to do through this litigation, is create accountability and transparency. Transparency in the litigation and to what's going on in our communities. Because until recently, the industry has had the benefit of this opioid distribution being in a closed system, sealed up within the DEA and ARCOS database. We hope one thing that we can do through this litigation, like what happened in West Virginia, that we can bring to light what's going on, so these individuals can be held accountable, not only in Buncombe County, but across the state of North Carolina, as well as the rest of the country. And again, I want to thank the Commission for taking the bold step to be the first out there and letting us move forward with this litigation. Thank you.
Great, thank you, Mike. We also have with us this afternoon Dr. Bruce Fagan and Dr. Craig Martin. Dr. Bruce Fagan is with MAHEC and Dr. Craig Martin is with VIA Health. And I'd like to invite each of them to make a few remarks about the significance of this problem to Buncombe County and beyond. Dr. Martin, would you like to say a few words first? Thank you.
Thank you very much for allowing me to be here with our important partners. We know what we've been doing for the chronic opioid crisis is not working, and there has to be a change. And to have social services, law enforcement, judicial, all of our partners, mental health treatment together can make a difference and can turn the tide. We know that about 9.5% of U.S. citizens have the chronic disease called diabetes. We also know that about 9.5% of U.S. citizens have the chronic disease called substance use disorder. And yet how we approach those disorders and how we treat those people is very, very different. We really need to change and open up funding opportunities. Some of you know that VIA Health is the local management entity and managed care organization for Medicaid in 23 counties in western North Carolina. Over the past year, we've distributed over 2,000 doses of Narcan. Narcan is a medication that can help somebody start breathing again after they've stopped breathing. But it's usually too little and too late to intervene at that point. We need primary prevention in the schools, we need more work, and we clearly need to stop having so many drugs on the street. The STOP Act, which has been passed by the legislature and will be implemented in stages, will be a step. We're very appreciative of all the efforts here. We can make a difference. We have to make a difference. These are our family members. Thank you.
Thanks, Dr. Martin. I appreciate everybody giving me the opportunity to come and talk to you all. Again, like Dr. Martin had said, I'm glad that everybody is around the table here and working on this. One of the things that we were told as physicians back in the early to mid 80s was that these medications are really safe, that less than 1% of people will ever be addicted, and that we should start, we as providers should start using these medications for chronic non-cancer pain. And that's just absolutely not true. The CDC, Centers for Disease Control and Prevention in Atlanta, put out some data in March of 2017 that showed that if you take an adult in the United States that's opiate naive, that means they've never had an opiate before, and they get a prescription for 30 days, a legitimate prescription for breaking their collarbone, breaking their arm or their leg, something like that. And if you give somebody a 30-day prescription, they have a 35, almost 40% chance of still being on an opiate a year later. These medicines are not as safe as they said they were. They're medications that are highly dependent and highly addictive medications. And I'm stand here with the county saying I'm glad that we're doing something about this now. So thank you very much.
Sir, could you give your name and title, please?
Sorry, yep. My name is Blake Fagan. I'm the Chief Education Officer at the Mountain Area Health Education Center here in Asheville. I'm a family physician. Thank you.
Great. Thank you, Dr. Fagan. I'm sorry I misspoke earlier. It's Blake Fagan, not Bruce Fagan. And now I'd like to invite any other county commissioners who would like to make any remarks. And then if there's any questions, many of the folks who have spoken would be happy to take those. Commissioner or Vice Chair Ellen Cross.
Thank you all for being here. Thanks to the media for covering this. This is the biggest attack on our community. And the only way we're going to get through it is through fighting. And I'm grateful that this law firm has taken this on with such vigilance. And I look forward to some resolve. Mr. Fuller very kindly said that the commissioners were brave. It's not us that's brave. It's the recovering folks that have gone through every obstacle so that they wouldn't succeed. Commissioner Fryer and I have held a town hall, and at the completion, 3 or 4 people came up and said, "Thank you for talking about this as a disease." That's what we have to address. These drugs were brought in here under false pretenses, and they're robbing us of citizens. They're robbing us of resources, but more importantly, they're robbing us of citizens, the babies that are in foster care, the paramedics that have to go out and deal with things that typically they would never have to encounter. So I embrace this fight, and it is going to be a fight, but more importantly, I embrace our citizens who have become victims of this horrible, horrible disease, and I hope we can get the resources to help all of you. Thank you.
I'm Jasmine Beach Ferrara. I represent District 1 here in Buncombe County. This is indeed a crisis facing our community, and with today's announcement of the lawsuit, we bring a 4th prong to our efforts to respond. We've been responding with prevention, with efforts to expand treatment options, and on the enforcement side of things. And this lawsuit is about the accountability prong of this strategy. I'm proud and honored to stand with this group of commissioners and expressing full support for this lawsuit. And beyond that, I hope sending a message to community members across Buncombe County that if you need help, it's out there. Addiction is a disease. Almost every family I know, including my own, has been impacted by it. And as a community, we need to make sure that the moment someone's ready to start accessing treatment, that there's a pathway for them to do that. Indeed, one of the motivations behind this lawsuit is ensuring that we have the resources as a community to make sure that treatment is available for everyone who's ready to access that. Thank you.
Mike Fryer. Ellen's right. We've been out working on opioids. We've had 1 town hall. We're getting ready to have 2 more. One's going to be Thursday night in Weaverville. It was heartbreaking in its ways, but it was educational in other ways. This county is, I'm glad we've stepped up, Mr. Fuller, and this needed to be done. Ellen's right. We have children that are drug addicts already, that are having to go to foster care and be taken care of. We have people that are killing themselves sometimes twice a day, and people having to bring them back. So this is one of the toughest things we're going to go through. Earl Siegel's going to be the local attorney here for us, so we'll have good options, all laid out. We'll have an idea of where we're going quickly. So but I thank everybody in the room. I do thank the news media for doing this, because we're going to have 2 more. There's going to be another one in Fairview on the 30th. So we want the people to come out. We want them to understand what's going on. So thank you.
Thank you very much for being here. This is very important, and I'm proud to serve with these other 6 commissioners that we did bring this forward, and we are concerned. District 2 has already had one or two of the town hall meeting. Myself and Commissioner Belcher will be starting in January, I think, of setting up District 3 of having a couple of the town hall meetings somewhere. So this is very important, and I think everyone's touched on their concerns, and we can never say what we really think of this until it's stopped. None of us are going to rest. Thank y'all very much.
Good afternoon. I'm Al Whitesides, the other commissioner from District 1 here in Buncombe County, and the newest commissioner on the board, by the way. But nothing hit home to me, folks, more than when we had our first meeting, Commissioner Jasmine Beachfair and me, we had our first meeting with constituents, and we do it every other month or so in our district. When at the end, we were at the West End Bakery in West Asheville, and at the end, I saw a lady and her husband standing there. And you know, you can see people that you wonder something is not quite right. Well, when I went over to speak to them and thank them for coming out, she shared with me that they had just lost their daughter a few days before from opioid overdose. And all I could do was just hug her, because I could think of nothing else to do. But this is what we are going through, folks, in Buncombe County, in North Carolina, and all over the country. I have family members, I have friends who have gone through a lot with this, and we cannot. That's why I want to thank our partners, the law firm, and everybody who's here today as we announce this lawsuit, because we cannot afford in Buncombe County or in the country anymore to just stand back and let this happen. We've got to speak up, because we are speaking up and fighting for a lot of people who have just given up. They've given up hope because they feel that nobody is there to help them with this disease. So I'd like to thank our commissioners for coming together, because this is a great team to work with. And we all really care about the people of this county, and we're going to do what we need to do to fight for them. And right now, this is the biggest battle we think we're facing. Thank you.
I'm Commissioner Belcher. I'm from the western part of the county, and I want to thank everyone for stepping up and making this part of our battle. This is just one of the strategies that the county commissioners are participating in. It's been said, every home, every family, we know folks that's been affected by this. After church Sunday, I left and went to another church at 2 o'clock where Dr. Fagan spoke in our community and presented to concerned church members about the devastating effects of opioids. If I'm not mistaken, after 5 days, there's a danger of a person's mind being altered, putting a state in dependency, though they don't even know it, in that short period of time. And it's time that we knock walls down between government, businesses, churches, communities. We realize that this is affecting everybody. It's affected my family. It's affected my church. 21-year-old girl. We had a funeral in my little country church in Canada. It's not acceptable. If we can do the things to get treatment for folks, you get them out of the market. One of the things that has to happen in Buncombe County is we got to drive the supply. We got to stop the flow of the pills, and we got to hold people accountable. That's what we're doing today. It's interesting. One of the attorneys is here participating in a lawsuit initiated from my hometown in Welch, West Virginia, where the devastation in southern West Virginia is hard to describe. And we want to take the steps to prevent that acceleration in Buncombe County. And this is a good first step. It's not just first step, there's been things going on. But I do want to commend this board. I've said it at where Dr. Fagan spoke. In the last year, we've accelerated the last several months. The urgency within the board has accelerated. There's been more done in the last few months than the last few years, and I commend this board for doing that. But I'm grateful for all that's in the room and all of our partners that work with us. And I've seen Pastor from ABCCM walk in. Thank you for your good work, and we'll all continue to lock arms and do what we can in this.
All right. Thank you to all the commissioners for your words. I think that concludes all the speakers we had. But I think we'd be happy to answer any questions that folks might have.
Just pray for the law, folks.
Sure. Mike, do you want to? Yeah, Mike, you back up here. I bet you'll be fielding.
Mr. Fuller?
Yes, sir.
I guess my question is, look at the lawsuit, Buncombe County versus Big Farm. Has this ever been done before?
When you say has it ever been done before, have others tried to hold the industry accountable?
Yes, and I'm talking about a county as opposed to a state or another entity, one county deciding to go forward with something like this.
There are numerous counties that are out there holding the industry accountable. They've done it in the past. We're currently doing it on behalf of a bunch of other clients as well. So yes, it is being done elsewhere. Buncombe is the first in North Carolina, though.
And you're essentially doing it pro bono. Are you live local? Is there a personal connection with this for you?
I actually do have a place in Waynesville, Haywood County, but it's not pro bono. It's called what we call contingency fee. So we get a percentage of what we recover, but we front all the expenses, so not to expend any public money during this litigation.
Can you
Yes, sir.
detail what you're seeking damage-wise? Is it monetary? You mentioned also information that you want to find out. What are you seeking?
One is to bring light to this issue. Yeah, I was talking to some of the commissioners before we started. This is and the doctor gave some statistics. You know, it's not talked about like diabetes is talked about. It's sort of a shameful thing, this addiction issue. But it's brought on people not due to their fault, due to the push by the industry. We, one, want to expose it for what it is, and two, get the county resources to basically abate this public epidemic that they're facing. The cost of drug-addicted babies versus a normal birth, $66,000 for every drug-addicted baby that's born versus $2,000 to $3,000 for a normal birth. So there's resources, and this goes back to what my dad taught me growing up. Community problems need community solutions. And that's why we're taking the county approach. We want to give the county the resources they need to address a lot of these issues.
So we have no set number on monetary damages?
We're going to be working with the county to build that damage model. And it's going to include, as spoken to earlier by Commissioner, education, law enforcement, as well as treatment. Those are going to be the three areas we focus on, and what it's going to take to finance those.
I know Barron and Bud's well known for representing municipalities. Do you have any sort of success rate now, or are these still ongoing lawsuits?
The lawsuits against the wholesale distributors are relatively new. The manufacturer industry has been held accountable over the past 2 decades for some of the misrepresentations, but the wholesale distributors are relatively new.
What was the decision? How was that process? I know there was a lot of talk about the distributors when the firm was selected at the county board meeting, but how did we come to the conclusion that we wanted to file suit against manufacturers and the distributors?
Because we think they're complicit in this situation, and what we found is that recently the DEA is also holding them accountable for the suspicious order distribution based on a kickback scheme where they were passed the distribution information from the wholesale distributors, giving them the same legal obligation.
I had a question question about the agreed upon attorney's fee. If I recall off the top of my head, it was 30%. Is that still the percentage we're looking at?
Yes, ma'am.
I have a question. You said that the damage model is going to be seeking education, law enforcement, and treatment. Is that also included the heavy burden that the foster care system is now shouldering?
Absolutely, absolutely, and that's where sort of law enforcement and treatment bleed over, because we're going to deal with the toll on the court system for the abuse and neglect cases, the foster care system, social services. All that's going to be taken into consideration. So what we look to do is a holistic approach to every area of the government that's being impacted, as well as our citizens, and how we can best help them and cure this epidemic.
You said this is relatively new on wholesalers. Have any of the cases been resolved? Have any been successful or not successful?
This originated in West Virginia, and we started filing the first suits there the end of 2016, the beginning of 2017, and those suits are still in pending litigation as well. Yes, sir.
Was the lawsuit officially filed today, or are you announcing it today?
It was filed this morning in the federal court here in Asheville.
Anyone from law enforcement like to answer a few questions? If you could do it up there, that's what we got in mind. Yes. Thank you.
Good afternoon. I'm Chief Mike Dykes with Woodfin Police Department.
Asheville?
Woodfin.
Oh, Woodfin, I'm sorry.
Yes.
How do you think this might help you all?
That's a great question. Looking at what the county hopes to accomplish, and looking at this as you said, a holistic approach. Our main focus has always been enforcement. We are looking for those who are breaking the law, but we are hoping that we can use this to also look at other alternatives, seeking rehabilitation and drug counseling and treatment, instead of plugging folks into the court system, finding those other approaches where we can help the individuals, help the community, instead of just making it an incarceration type issue.
What's your gut reaction? You're sitting here and you're hearing all these people want to jump into it and do the best they can. Does it make you feel like your job might be easier?
I believe it could be. I believe if we could hold those who are distributing the drugs accountable from the wholesaler aspect, if you have less of the substance in the community, obviously that's less that we're going to have to deal with, less auxiliary effects that go with it. We talk about the victims, those who are addicted, and we obviously want to do what we can for them, but there are other victims who are part of this as well. You have the families that are impacted, but you also have the need drives things such as crime. And if we can reduce the need for these drugs and reduce the amount of drugs that are there, then obviously it's going to trickle down to other aspects.
Thanks.
Thank you.
Can I ask, probably for you, Mr. Fuller, is probably the most appropriate, but how similar is this lawsuit language for Buncombe County versus your other clients?
Y'all want me to go to the mic? I will. The general language is very similar. The counts are to some degree similar, obviously tailored for North Carolina and Buncombe County. There are specific information related to Buncombe County included in the complaint as well.
One question is, I was kind of counting on the face cover of the actual lawsuit.
Yes, sir.
I counted like, I know there's subsidiaries, but I counted like more than a dozen of separate names. But in the news release it says I counted 7. I'm just trying to figure that out.
So the additional ones are subsidiaries of the parent entities. We just named the parent. I believe the county just named the parent entities in the press release.
But do those then go individually into the lawsuit, or?
They all get sued individually, but ultimately, if you know, a settlement's reached, it would probably be with the parent entity.
So for us to say more than a dozen companies, pharmaceutical companies, that would be correct?
Yes, sir.
Okay, thank you.
I have a question, but I think it's maybe more for somebody or one of the commissioners possibly. There's been a lot of talk about stemming the flow of drugs into the community and how that's going to be a really important factor in all of this. But some of the counties surrounding Buncombe are facing huge hurdles as well. Western North Carolina in general is facing a lot of struggles. I'm curious, has there been any talks with other commissioners in other counties or any leaders in other counties? Because if Buncombe is stopping the flow, there's still all of these other counties outside of it that are underfunded, under-resourced, and are not able to do what Buncombe's able to do.
I've spoken to some other folks on different health and human services boards and encouraged them to follow the path we're following, and also connected them with Mr. Fuller's firm. So I think there's a lot of conversation, and kind of as Buncombe County goes, hopefully they can reach out to some of the counties that don't have the resources that we have. But even though we have a lot of resources, this is going to deplete them if we don't have a corrective action.
It is a great question, because these pills know no bounds. They're not confined to Buncombe. We have met with McDowell County, right next door. We also represent the Eastern Band of Cherokee Indians, east of here, and met with Haywood County as well. We've also been hired by Hanover, which is on the other coast, in Wilmington. Tomorrow we're speaking to the North Carolina Association of County Commissioners, lawyers for that group, about representing additional entities as well. Yes, I think you're right. It has to be a holistic approach, because just fixing the problem one area isn't going to do the job. We've also met with the Attorney General, Josh Stein, and know that he's working on this issue too. And we offer to work hand in hand with him in addressing this problem across the state.
We know that many of our local frontline service providers and safety net providers are seeing people from across the region, whether it's for prenatal care or babies born at Mission who've been drug exposed. So that's another one of the ripple effects in terms of Buncombe-based service providers who are feeling the regional impact, and where there's a coordination in place between local providers and Buncombe-based providers doing regional work.
Do you have any idea of how long it may take till we see the end of the lawsuit, whatever outcome that may be? I can have you look in your crystal ball.
Probably best for me. It just depends. This litigation could go many different routes. We plan on pushing forward as hard as we can, as fast as we can, because, and I think the numbers show it, at least 4 people are dying every day in North Carolina because of this epidemic. So the faster we move, and that's one of the reasons I think Buncombe selected us, is because we can move so quickly, get this issue out there, and hopefully get resolution so we can put a dampening on the number of deaths going on and how this epidemic is impacting everybody.
I think one of the side effects, but a profound effect, will be the education part of this, that before somebody takes a prescription for an opiate derivative drug, it gives them enough pause to say, I don't want that. And MAHAC has done an extraordinary job with educating, but I think there'd be many ripple effects for this lawsuit, and I think if those prescription writers and takers can pause and say, I better not do this, we'll be way ahead of the game.
One thing I hope it can do, filing the lawsuit, there said 68 people, average, every person in Buncombe County has the drugs. If the drug companies and the vendors of the drug understand they're getting sued, hopefully they'll get an understanding that it's not going to happen in Buncombe County, and they'll start backing.
Is there a problem here with the prescription drugs and illegal drugs? What is the difference and which one's the biggest?
Is that for me?
Yeah, that's for you. You're the lawyer.
Sometimes. Depends on who's asking. Yeah, so what we've seen up in Paul Farrell's hometown, Cabell County, West Virginia, is the transition. And studies have shown that when you start on the prescription medication, when you first misuse that, 80% of heroin users first abuse prescription opioids. So you're going to see that tide change. You're going to see the switch from legal prescription drugs to the illegal narcotics. And what I've explained to the commissioners and we've talked about is the fact that things may get tougher before they get better, because we are going to get control of the pills. But the addicts don't just go away. We have to get them the treatment, but they are going to seek other alternatives. And that takes them to the illicit market. But one way or another, we're going to clean up this county.
What about addressing the flow of fentanyl and those substances coming into the community as well, which are starting to see higher death rates from that? Absolutely.
And with law enforcement, what we plan on doing is developing our damage model 2 task forces, one for the prescription side and one for the illicit drug side. And that's where the locals will be able to get a hold of it. And again, it all goes back to shedding light on this industry. You know, all this information is closed within the distributor's own computer banks, within the DEA and this ARCOS database. And through history, one of the things that's helped solve this problem, this isn't the first time that opioids has been an issue. You go back thousands of years to the opioid wars, is shining a light on what's going on, letting everybody see, and then local law enforcement can do their job and enforce the laws. But right now, everybody's in the dark, and that's what we hope to change.
I think it's also important as we have discussions with Mission Health, as we have discussions with the doctors, as we have the cameras in the room today, we're discussing a lawsuit, but we're discussing opioids and the problem in Buncombe County and our intent to improve that problem. And what happens with folks is that their mind changes. The STOP Act is a good law in the state. I think for acute pain, after 7, they limit it to 7 days. Is that right? So acute pain. So for those that are concerned about, well, what's the other pain called? Chronic. The chronic pain. There are other opportunities for treatment for that. If we can slow down or stop the flow of the opioids, we can reduce the number of opioids, then you reduce the addictions, the people that are addicted, and you reduce the supply. The people that were addicted on opioids, they stepped into heroin because it became cheaper because they couldn't get the pills. Well, if you can stop the addiction to heroin, to the opioids, then you'll dry up the market for the heroin. You'll have to go somewhere else.
All right. Any other questions? All right. Well, on behalf of the County Commission, thank you all for being here. Those are fantastic questions. I appreciate how our local media has taken this issue really seriously. And again, thank you to our council for working with us to initiate this action today, and for our partners in the medical community and law enforcement community. We look forward to working with all of you, as has been said before, on what's going to have to be a multi-pronged approach, but we think the action being taken today is an important part of that. So I think we'll conclude the press conference today, and everyone have a good evening.